Hi, everybody, and welcome back to Physical Therapy Distance Learning. My name is Joanne Ingram, and I'm a school physical therapist for the County of San Bernardino. So, today we're going to work on assisted standing for a shorter child. So, the first thing I'm going to show you is the height your child needs to be able to do this technique. So, I have my therapy doll here. This doll is actually 36 inches tall. And you can see if I stand my child in front of me, what I need is for their hips and butt to be no higher than my shoulders. So you can see that my doll is just about the right height. The hip area is below my shoulders. So if you sit behind your child and hold them in a standing position and their hips and butt are way up here, you can't do this. But don't worry, I'll be back with techniques for standing a taller child. Okay, so let's talk just a little bit about why we do assisted standing. So, the first thing I want to make clear is that I can't guarantee anybody that assisted standing will or won't help your child to walk. But I can guarantee you that nobody learns to walk without learning to stand first. So, if your child has a lot of mobility on the floor, maybe they sit up unassisted, maybe they crawl, or even get up onto their knees, then it's absolutely appropriate to move on to assisted standing to see how much progress they may be able to make. Now, if your child doesn't have a lot of mobility on the floor, maybe they can't even sit up without assistance or they're not even crawling on their belly, there's still a lot of benefits to assisted standing. So, when you stand a child, it's going to help to normalize their muscle tone, whether they have low tone or they have spasticity or a combination of both. Standing is not only going to strengthen their leg muscles, but help to strengthen the stabilizing muscles around all the joints so that they're able to hold a position against gravity. And it will also help keep their tendons stretched out so they don't get contractures or tight tendons that restrict their movement even further. Okay, so let's get started with assisted standing. The most important thing is that you find a surface to stand your child at that's the right height. So, what I have here today is just a lawn chair from out of my backyard. And for my therapy doll that's 36 inches tall, a standard chair is going to be just the right height. So let me show you. When I stand the doll at the surface, you can see that her waist, marked with the belt, is right about at the level of the chair. And that's right about where you want it to be. If you use a surface that's significantly higher, it's going to be difficult to do this technique. If you use a much lower surface, your child is just going to tend to lay forward on it, and it's going to once again, just make it a lot more difficult than it needs to be. Okay, so right about waist height or upper stomach. Okay, let's talk just a little bit more about the surface. So I've chosen this chair because it's fairly wide and heavy. So that's going to make it nice and stable. And my child isn't going to be able to slide it or tip it easily. So you don't have to use a chair. You can use a table or an upholstered piece of furniture. Start with looking for something that's stable and the right height, just a little above your child's waist. Now, the other thing you're going to need is an open underneath. So you don't want to use a chair that has rails across or a low piece of furniture because you're going to need to put your legs underneath that surface, that table or chair, to hold your child in the correct position. Okay, so it needs to be open underneath. The other great thing about this chair is that it has a cushion that's tied on. So you want to cushion the surface you use in case your child should flop forward onto it or if they're super resistant and they try to bang their head, they're going to be safe with a nice padded surface. And because my cushion's tied on, my child can't get angry and try to throw it or strip it off. It's just not going to go anywhere. So if you don't have a cushion that you can tie on, you can cushion your surface with a pillow, a fluffy towel folded up, or a really good idea is to use a bath mat. So I just have an old bath mat here, and bath mats are great because they'll be fairly thick and fluffy, and they'll be nice and big and kind of heavy. And that's going to make it just more difficult for your child to grab it or find the edge and strip it off. Okay. Also, a lot of bath mats are going to have a non-stick backing on, or a non-skid backing on them. So it's going to be harder for your child to slide it out of position. So the other thing that's great about this chair is that it has this nice rolled edge. So if you use something with a rolled edge like this, it's not going to poke or pinch your child when they lean on it. So if you don't have a rolled edge, you can take your bath mat or towel and just kind of flop it over the front edge of your table or chair that you're using to give it some padding. Okay, so just to review, look for something that is the right height, fairly stable, open underneath so you can slide your legs underneath it, and cushion that surface with whatever you have that's going to work for you. If your child is super resistant and they keep on throwing that bath mat or that pillow off of the surface, just grab some duct tape or masking tape and tape those ends on. Okay? You believe me, if you are trying to stand a child that doesn't want to stand, you're going to need all your hands. You don't want to worry about them banging their head on a hard surface. Okay, so we're going to start by putting our child in our lap, just like this. And you're going to slide your legs underneath your table or your chair and get nice and close. So the next thing you're going to do is position your child's feet. So I'm going to put one foot on the outside of my leg and the other foot in between my two legs. So that way I am able to stabilize the foot between my legs and hold the ankle in a good position. And this other leg I can keep an eye on and even roll my leg into it. If they happen to be sagging in, I can kind of straighten them up just by shifting my leg. Now, if your child has braces, either ankle or ankle and knee braces, you definitely want to put them on for this. It's going to make it a lot easier. It's going to just automatically keep them in a good alignment. So, I'm going to start by putting my child's hands up on the surface, and then I'm just going to lift them up and lay their chest on the surface that we're using. Okay, so once they're here, I can go ahead and take another look at the feet and readjust them if they've come out of position. And I'm going to center my child right in the middle so they're even over both feet. Okay? And you want to make sure you're scooted up nice and close so you're actually against your child and they're against the chair. You're going to need to be nice and close to have the leverage to keep them up. Okay, so then you're going to take one of your hands and reach around both knees and hold those knees back. Okay, and then you're going to lean your chest into their hips or bottom. So you can see right away, I've already gotten some lift going here just by leaning into my child and pulling those knees back. But I still have a free hand. I can prompt my child to come up off the surface and come all the way to standing. Okay, so there you are. Here's your work. So here's your child when they either are not able to hold that position or they don't want to. They're trying to sit down, their knees are bent, and their hips are coming back. So I'm pulling those knees back toward the straight position and leaning into their hips with my chest. And boom, they're standing. Okay, so if your child is very resistant, after you get them up, you can take that other hand and use it to help keep those knees back while you lean into their hips to keep them forward. So they'll try to sit here like this, and you will keep straightening those knees and pushing those hips forward. I'm going to check that ankle, make sure it's in a good position. So now I have my child standing, and the idea here is that you want them to take over the work. So you can start by giving them little pushes, those little prompts, to just give them the idea that you want them up with the hips forward and the knees back. Okay. And then as they start to get the idea, what you will do is gradually start backing off your pressure. Nice and slow, so they don't even realize that they are taking over and doing the work. So, if your child is willing to try this, it's going to be fairly easy. You may just be able to hold those knees back with each hand, maybe even just grab onto their belt or hold them at the waist to balance them a little bit as they work on standing. If your child is resistant and pushes back, then this is going to be a lot of work for you, okay? So if you're here and you're trying real hard to keep them in the standing position and they're not happy about it, they don't want to do it, they're pushing back hard against you, then just start with about 5 to 10 minutes or however long you can hold out. Remember though, it's important if your child is using resistance as a way to get out of an activity that they understand that when you're finished, they're going to get to sit down because you're done, not because they cried and resisted and got their own way. So a good way to make sure that your child knows that you're in control is to just tell them, okay, we're almost done, 10 more seconds. And then when you count down those 10 seconds, when you get to 1, say, okay, we're done, and let them come back to sitting. Okay, just remember that if your child cries and gets their way, that reinforces their understanding that they can control the situation by crying. So I understand it's difficult to let your child cry, but it's definitely one of those tough love situations where the benefit of your child learning to stand far outweighs the difficulty of letting them cry for a few minutes. But of course, it's your child, so it's always your choice. But just remember that a lot of times children are resisting because that's their way of controlling the situation, and they're not really in pain or afraid. If you think about it, in this position where they're standing at a surface and you've got your chest against them and your arms around their legs, they should feel super secure and supported. There's nothing for them to be afraid of here. So don't be afraid to push their time up a little bit. Like I said, start with about 5 to 10 minutes or as long as you can physically hold. and then end the activity on your terms. If your child is not resistant and is happy to work with you, that's fine. Start with about 10 minutes or so and keep an eye on them for fatigue. If you see them starting to get shaky or look distressed, then go ahead and stop. Kind of take a look at the time so you see where their endurance is at and where you need to work next time. Okay, remember too that standing for a child that's 3 or 4 years old is probably just something that they're not used to. So go ahead and do this every day if you can, or as frequently as you're able, for a few minutes at least, to get them used to the fact that they're doing the activity regularly and they get a feel for the position. I guarantee you, as they get used to it and it's not so new and different, it's going to become less of an issue for them, and eventually they'll start to enjoy it. Okay, so that's assisted standing for a shorter child. So I'll be back with another video in a week or so with a technique for standing taller children. Okay, thank you for watching, and remember, stay safe, stay home.